Welcome everybody to the afternoon session. It's a pleasure to have you here. And we have an outstanding panel of European experts and coordinators of European projects. European hubs for cancer and for the storage and sharing of cancer data. So these are the coordinators of projects such as CANDLE and ECOS, which is one of our sponsors as well. The leaders of this roundtable will be Mr. Ian Gauci from Ciencia Malta, who will introduce us to this world. And many of the speakers have a brief presentation of their organizations and the networks that they are representing. So you are really very welcome here. Thanks for coming to Tenerife and letting us know about the possibilities of these interesting European projects and networks.
Thank you very much, Alicia, and thank you to ULL and to IPNA and CSIC for inviting us to Tenerife for this session. So this session will actually change a little bit the mood that we've had so far in this conference. So far, the conference was mostly scientific, and we've seen some really interesting projects and research being undertaken by several researchers. But now this roundtable is more shifting towards the policy side of things. So now when we say policy, it's like more the framework conditions on how this research that we've heard in the past 2 days, how they can kind of be translated really into results. So the policy kind of enables this research to happen. And it is really my pleasure today to be moderating this session. Myself, I am Ian Gauci. I come from Scienza Malta, and I am also a work package leader in the ECOS project, which is about the setting up, the establishment of national cancer mission hubs. And it's my pleasure today to have assembled a good panel where we are going to discuss how the National Cancer Mission Hubs feature in the overall European data health space, so indeed EHDS. The EHDS is quite a new concept. It's an old concept, but now it's really becoming central to the implementation of the EU's cancer mission. And the National Cancer Mission Hubs, from our perspective, we need to understand a little bit more how the National Cancer Mission Hubs can really play a role in this whole EHDS landscape. So without further ado, I will start introducing the panelists we have for today. So the first one is Ms. Ana Toledo. She is from the Cancer Mission, so she will be representing the Cancer Mission. So Ms. Toledo, please. Second would be Hugo Soares from ICIP, and he is the coordinator for the ECOS project. So these are the National Cancer Mission Hubs. Next would be Harald Wagner, who is the coordinator from the EUSIP project, and the EUSIP is a project which has recently been funded, which focuses on the ECP disease, which is the patient portal, and then CANDLE project, and we have Lifang Liu here, who will be representing CANDLE, which is a project to develop the national cancer data nodes. Online with us, we also have Kadelis Weyman, who is online, and she is representing the Ancan Connect project, which is a third project which was funded under the 2024 Cancer Mission Calls on this open source Federation of Federations platform to facilitate this access to cancer data. So now I would like to invite Ms. Ana Toledo to present the cancer mission. So the floor is yours. Thank you.
I want to use a clock. I don't want a second. So good afternoon. I am really happy to be here as an ambassador of the Cancer Mission. I'm Ana Toledo. I work in CSIC. I'm new to the institution, so I'm happy to be here also as a part of the organizing institution. And I'm really glad also to be here with my colleagues from, okay, thank you, with my colleagues from Horizon Europe and Cancer Mission projects that I'm really looking forward to hear about. I'm going to present briefly what the Cancer Mission is. Where do I have to point the... So why the Cancer Mission? Marco this morning did a really good presentation on why. Okay. Okay. Thanks. So also presented some kind of data. We all know that cancer is a leading cause of deaths in worldwide, but especially in Europe, where the incidence is 25% of global cancer, while we are only less than 10% of global population. This is due to the aging population and many other causes as lifestyle or contamination, exposure, etc. It also implies a really great burden of disease, of care, of very complex care, and a really great burden to society and economy. These ciphers are not expected to get better in the near future, and in 2040, they are expected to grow in a 20%, which means 5 million new cases annually. So this is a great challenge and has been selected by the European Union and one of the 5 strategic challenges for our society in Europe, with soil degradation, ocean pollution, climate change, and they have been elected as missions for Europe. So what does mission means? It means that they need a really big strategy with collaboration and partnerships, looking for synergies from a whole lot of stakeholders, and to engage in large-scale efforts with all these actors. The mission point of view, if you want to know more, it's a Mariana Mazzucato perspective, and this economist wanted to engage all the society from top down to low up in fighting against cancer, in our case. The cancer as a key priority for the European Union is both a research and innovation problem, which is the mission of the Mission Cancer that was launched in 2021, and it's also the mission of the European Beating Cancer Plan, which is an initiative that, as Ian said before, is more a health policy initiative. What is the main objective of the Mission Cancer is to improve the life of 3 million people before 2030, making their lives longer and better. Okay. Well, The mission proposed a new governance of research and innovation and of policy making. It tries to find this connection between the both. So the research is able to improve these 3 million of lives, and it's engaging not only the research director, but also the DG Sante, which is the health directory, and the member states. But also the mission and the European Beating Cancer Plan try to engage as much as key actors as possible: researchers, clinicians, policymakers, philanthropists and foundings, and of course, citizens. The overall funding for cancer research in Europe, across Horizon Europe, from 2021 to 2024 is 2.5 billion, and only for the cancer mission since 2020 till last year was for 8.8 million. But the most important thing is what is the mission doing, what are the priorities, and what is the implementation plan objectives. We have 4 main objectives. The first one is advancing cancer understanding, which we are going to hear after from the key project that it's on CAN. The second one would be promoting and prevention and early detection. The European Union is given a lot of emphasis in screening, promoting the best effective screening programs, and trying to promote calls for more screening of new types of cancer, well, of cancer types that do not have screening. It's putting a lot of emphasis also in prevention. A lot of preventive measures are already known. The code against cancer is really clear. It's been there for a long time, and it sets the 10 priorities and the 10 possible actions for prevention, but it's not well delivered to society, and most of the people are still don't still know how to prevent cancer. So there are many calls engaging with behavioral change that could change this. It also, the third pillar is enhancing diagnosis and treatment. The main project there is, maybe you heard about it, comprehensive cancer centers. The objective is that 90% of the European patients with cancer will be available to have high quality care and reduce inequalities in care at the end of the process in 2030. And the fourth one is improving the quality of life, mainly of survivors. Survivors are increasing in numbers in Europe. There are more people surviving cancer, but the consequence and the long-term consequence are not really known yet and are not really being worked on. And some calls are also pointing at this way. For transversal priorities, I'm going to be quick. Equity, the diversity of cancer care, cancer knowledge, cancer prevention in Europe it's really diverse. So projects as the Cancer Mission Hub, we hope that they give a little bit of more equality in this place, and they also are going to engage patients and citizens. The European Union has already made some citizen engagement moves, for example, with childhood and young adult cancer that are mainly rare cancer and are mainly under-researched and underrepresented in the cancer policies. And it's trying to fund more research and give them more voice in the process of policy making, and call development. So thank you very much. And if you have any questions,
So thank you very much. And now I would like to invite Mr. Hugo Soares from the ECOS project.
Tight space here. Thank you very much. Before I start, I'm very, very happy, and this is not just polite and ironic or whatever, to be here, because today we are speaking to the research leaders of the future. This is about advancing biomedical research, and you as early career researcher or PIs or professors, you are the ones that are creating the next generation. And the next generation will be doing what you showed in the morning, experiment, discovering breakthroughs. But if you want these breakthroughs then to be implemented in new technologies, new products, new services, new drugs, you need supporting policies. But it's not just that policies are supporting past research, but it's also you need policies that enables future research. So when we talk about policy, we talk about, for instance, defining priorities for funding in the coming years. Today, or nowadays, in this couple of months, at the European Commission level in Brussels, they are discussing the budget for the next framework program. This means that in Brussels, people are discussing where money will flow in the coming years. So even though if you have a very good, bright idea in cancer, if they decide that the money will be targeting cardiovascular or One Health or whatever, your idea might not be supported in the future. But the same thing, you have now a very good result. We heard this morning very good examples in antimicrobial and cancer. If you don't have enabled policies that enables this to flow from breakthrough research to implementation, you have a theoretical exercise which is really nice, but then it's just a paper that is published. So what we are talking here, and even though it might seem a little bit off, this is the part that enables you to do science and to continue. And this works before the bench work and after the bench work. A couple of years ago, on this mindset, the European Commission start working already in the previous presidency, start working, so during Horizon 2020, start working with Mariana Mazzucato, as Anna has alluded, to decide where to go next, what would be the future priorities in European landscape, and they decided for soil, water pollution, climate change, and in the health sector, they decided cancer is the one to target. They could have decided for cardiovascular, they could have decided for infectious diseases, they decided for cancer, which is very good for the community I work for, but not so good maybe for other communities. We can see this as we are the front runners, we are the ones dealing with the problems, and then when the money flows to cardiovascular, some of the things, some of the problems, let's say, the hurdles were already tackled and they flow more easily. They decided cancer for a lot of reasons. Marco has alluded, Anna has alluded. I will not go into that direction. And this brainstorming, this prioritization at the European Commission resulted in two key documents. One, the European Cancer Mission on Cancer, and the Europe's Beating Cancer Plan. These are two very important high-level strategic documents emerging from two different director generals, the health and the research. So imagine European Commission working as a government, you have two different ministries, health and research, and they are aligned in their priorities. How good is this? Now, the EBCP is like a strategic plan. There is no money attached to it, while the European Cancer Mission is an operational, high-level operational program with a financial envelope attached. So for you to implement fully what is in the Europe's Beating Cancer Plan, which is a little bit more high level, you need to implement what is in the Cancer Mission, and one coordinates with the other and help support to implement each other. There are 10 different flagships in the Europe-splitting cancer plan, 13 bold recommendations in the European Cancer Mission. And as you can see here in this slide, politicians, right? They want to do everything from understanding more what cancer is to prevention, to treatment, to quality of life, transversal activities, everything. Now, these are bold actions, and this is typical from what is a mission-driven research. Mission-driven research emerges from the days back from what we know as the Apollo mission, going to the moon. Let's set a bold, ambitious goal, and let's go for it. And while doing that, other technologies are created. Microwaves, X-rays, mammographies, whatever, that emerge from initial findings that were created, that were designed and created with the ambition to go to the moon. These are the kind of things that mission-driven research is about. Here, the mission-driven is not to go to the moon, but to save the life of 3 million people in Europe. They have set up these different recommendations, but they also know that if you want things to be done, you cannot just have two very nice documents emerging from the Commission and staying in the drawer here and there. You need to operate at the local level, in the national communities, in the local hospitals, universities, patient associations, policymakers, municipalities, and so on. And with this in mind, knowing that if you want to change things, you need to change them at the national level, they have issued this concept of cancer mission hubs. So hubs working towards implementation of cancer mission at national level, which is called the National Cancer Mission Hubs. These are brand new structures that this concept was coined with the implementation plan of the cancer mission. And now, yeah, this is a theoretical thing. How do we now, well, how do we create now national cancer mission hubs in the different member states? That's where this project comes from. ECHOS project is about enabling the creation of these structures. These structures can be implemented from scratch, nothing exists, and we organize the community towards the creation of the hubs, or we can build from existing structures. For instance, in Spain, one of our partners is leading the National Mirror Group for Cancer. Okay, so there was already an existing structure here, the Cancer Mirror Group, coordinated by Instituto Carlos III, that participates here. Okay, and we have different situations across Europe. You will see in my last slide and acknowledgements, we have 30 different countries, 60-something, 61, I believe, partners. So we have heterogeneity and we have diversity here, and that's where richness comes, because we can tackle different things with multiple examples of it. And like Ian was saying, and I alluded also at the beginning, the idea here is really to enable actions, to have policies that enable actions to happen, and to have actions that then are transformed into policies so they are regulated and so how to operate. So ECHOS project is about enabling national cancer mission hubs to emerge in the different countries. I do not have the mandate, even though I'm the coordinator, to go to Spain and say, look, now you're doing this. Come on, who am I from Portugal to go to Spain and say what you have to do? But we are working with different partners saying, this is how things work in this setting and that setting, and these are the benefits and the added value. And it's up to our partners to then make it happen in their own country, okay? So we start this from, we have different objectives. One is to enable this creation of the hubs. We are supporting in different levels towards creating a network of support to the cancer mission. It's not up to ECHOS to implement all the 13 recommendations from the cancer mission or the 10 flagships, but to make it happen in the country by connecting the different dots that are in the country. So we have our mission, we have organized the National Cancer Mission Hub model because they coined this concept. But how does it work in the field? How does it work in Poland, as in Portugal, as in Sweden, as in Greece? We have to come to an agreement. That's what we did in the first year and a half of the project. We came to an agreement between partners and between countries on what the National Cancer Mission Hub is and how it is different from an hospital, a cancer center, a university, an innovation agency, and so on. What is unique about it, and how can we work together with existing structures? I want to highlight here that figure which looks like a flower is actually a pentahelix of the different sectors, and it's important, as I said, to implement mission-driven research that we involve all the sectors. We involve not just researchers and physicians, but also patients, innovators, social care workers, and so on and so on and so on. There are different models for the National Cancer Mission Hubs to adapt to the different countries and ecosystems. And we are also implementing what we call a recognition system. It's not just because you raise your hand and say, oh, I want to be a National Cancer Hub, that you are a National Cancer Hub. There are criteria to meet. And so we implemented a recognition system to assess and guarantee quality of what we are delivering. At the moment, we have already recognized 5 different National Cancer Mission Hubs in Poland, Greece, Malta, in the Netherlands, and in Bulgaria. Until the end of the year, we will have 5 more to come. 2 of them had already their official launch, and as you can see here by the very nice pictures. We are supporting these hubs by creating a body of knowledge, a lot of paperwork, but also by having consortium meeting where we train each other in the different aspects of how to implement mission-driven research. We have private meetings with decision makers in the different countries to help raising awareness and understanding the importance of implementing cancer mission throughout Europe. Again, fighting inequalities or building equity across Europe. And we are present in public events like this. Well, this is more targeting the researchers, but others with policymakers, so we can do it the same thing, but instead of closed door, we do it in public. Some countries, as you can imagine, work better in one way or the other. And so we have the public support, we have more closed door meetings, and we have the consortium capacitation. One of the flagships in our project is also to build on what is citizens' participation, or in cancer, patient participation. Both are important, one more involved in prevention. If you want to prevent, you need to target citizens, treatment, patients. And you can also think that citizens are the patients for the future, because 1 in 2 will get cancer according to statistics, and we work them differently. This is something that is not so. If I ask you, researchers, how many times do you engage with citizens in your research? Maybe with patients, yes, because you are linked with university hospital, but how many times do you engage with citizens in your research? Most often, I have a few only in the room. So this is something that we are trying to also allude to and to raise this awareness. And we organized this Cancer Mission Fair together with the European Commission 2 months ago in Poland. We had the launch of the National Cancer Mission Hub in Poland, and we had several sessions with workshops on this and that. And if you want to know more, I'm going really fast because there's a lot of things, and if you want to know more, please contact us or go to the website. We also organize what is the Synergy event in the same cancer, or the Synergy Days in the same event, because money is pouring on cancer at the moment because of EBCP and European and the mission. And even though there is a lot of money for cancer, we all know it's not enough. But this creates several projects working in different topics, one more neuroblastoma, the other more blood cancer, whatever, but where they can touch each other in, therapeutic approach or engaging with the patients, or so on and so on and so on. And you can either give the money and let it go, and there will be some duplications, or you can try to make more out of your money, more efficient use of your money by creating these synergies, and where people can connect, they connect, and use study groups or pilot studies for more than one project, and so on. We are also looking into synergies beyond health with the cancer soil, the soil mission, the climate, and so cities, oceans, and so on. And this will be 30 seconds, 10 slides. if you go to our website, you will find several resources that might be useful for you as a researcher. One of them is how to create impact in research. This, you will see different impact models for prevention, for therapeutics, and or for treatment, and for quality of life. You have webinars exploring cancer mission, what is cancer mission, what is the purpose, what is citizens engagement, what is community engagement, how to collaborate with industry, the right to be forgotten, some more policy, and so on. You will find publications and webinars where we participate and we disseminate our results and the work of our partners. You can find a community on cancer. You have examples on how to engage with citizens in research projects, namely in health and cancer in details. And this is where you find in our repository gallery and libraries. There are many, if you like to read, there are many reports that you can read. And this is my last slide, where I want to thank all our partners. And with this said, you heard a lot of things, and now we will be targeting 3 specific projects on digital health, namely digital cancer health, or digital health and cancer. This is how the National Cancer Mission Hubs can help at the different countries to implement 3 very ambitious projects in one specific topic. As National Cancer Mission Hub, we have to target everything, let's say, from quality of life and so on. Here we bring you the example on the digital, which I hope will be useful for you and you enjoy. Thank you very much.
Thank you, Hugo. Thank you, Anna, for this. I wonder if there are any questions in the audience for the first 2 speakers. Maybe we can take a round of questions now before moving on to the project. So yes, Alicia.
Thank you very much for this excellent introduction, and to Ana Toledo as well. It was very interesting. But I was particularly curious about the engagement of citizens in the project, because I think it's very important, this aspect, because part of the success on cancer is the prevention. How are you involving the citizens? Through associations or with individual, let's say, not individual, but public actions, apart from contacting with associations?
The Commission has engaged for children and young adults, has engaged both patient associations that are organized and have a more structured opinion about things, but also just survivors of cancer. For example, they have done, I think, 3 or 4 workshops with them to establish what were their needs, what were they experience, and what do they think that should be improved in survivorship of young and adult cancers. And I think these dialogues really created a basis for calls that are really adapted to the needs of survivors, because sometimes there's this gap between the needs of patients and what is research, especially in implementation research, for example, or in some the outcome measures sometimes are not really what the patient needs, but what the researchers can do or can imagine to do. But I think these kind of dialogues really were a breakthrough for the Commission and the research directory to improve the calls. And we have already seen it in the calls of last year and this year.
And if I can complement with the information at the national level, so Anna just described what the Commission is doing, so namely engaging patients and citizens in the discussion of European policies. It's up to the National Cancer Mission Hub in each country to engage with citizens and patients in their respective country. Okay? So we can talk about what Portugal is doing, for instance. What the project is doing is sharing these experiences. I go with the Portuguese case and say, in Portugal, we do it like this and it works, but it doesn't work on that direction. And Austria, for instance, or the Netherlands come with a different experience. And so ECHOS itself is not engaging with citizens and patients directly at the national level. We have patients in our board, advisory board, and some partners are also representing patients, but the project itself is not going to Malta, the Netherlands, Spain to do it. We train our partners on how to do it. I'm not sure exactly what is happening in Spain.
In Spain, the hub is not working at the moment. It's being developed, but at the Mirror Group we have 2 patient associations. The POP, if you know, the Plataforma de Pacientes, that is the biggest federation of patients in Spain of chronic disease, and the Asociación Española contra el Cáncer, who is not a patient association but has a section for patients. It's also sitting in the table. And at the moment, I think that, and in Spanish projects, as you may know, it's the patient engagement is really encouraged, and it's time. I think they are the obligation to engage patients is going to be more and more, I think.
Yes, there's another question there.
I'm curious with these missions, because there are several missions. How do you guys measure the success of a mission in case that you do not cure cancer, because it probably doesn't happen? How will you say at the end that that was successful or not?
One of the parts of the mission that I did not have time to do is we're preparing indicators to measure the success. With our objective is not to cure cancer. That would be a great one, but I think it's too ambitious for 2020. But just to improve the life of people that would be otherwise affected by cancer. For example, new screening programs would count as an improvement of people that would not have cancer or would have early detection of cancer. And with the indicators are being built at the moment since last year, I think. So would measure what policies and how many people would be affected by those policies, and how many people have participated, for example, in effective preventive measures, and how many people are engaged in citizen engagement, for example.
This is at the level of countries or the institutions that they participate? Because, I mean, I had to say, this is huge. There are so many layers that sometimes it's hard to process.
Yeah, I think there are many indicators. Some they are really clear and some are not. For example, there are a lot of European countries, they didn't have any screening projects. So now they do, and that would be counted. For example, the cancer center, the excellent cancer, comprehensive cancer centers, that would engage, that is supposed to arrive for 90% of patients. This is a clear number, and some other numbers, it's true that they are more diffuse. But there's a set of indicators that are being built. Yes.
just to complement, at the European Commission level, you have different committees. You have the Strategic Program Committee that is high level, then you have Subcommittee for Cancer, and you also have a committee which puts the Cancer Mission and EBCP or DGRTD and DG Santé together. So you have different committees. And in these committees, you have representatives from the different countries, the member states and associated countries. They are all invited to attend these meetings. It's through these committees that the Commission collects some of this data. The other strategy is the Commission themselves. They outsource, let's say, to a consulting company like a report to have an independent assessment of the cancer implementation. And you'll even have a third way where the Parliament, because in the end, the Commission, the money that the Commission is distributing, Horizon 2020, Horizon Europe, whatever, as you know, it's approved by the Parliament. So there is also this evaluation that the Parliament exerts over the Commission to know if what was approved is being, used in and how it is being used. So you have, at least at the Commission level, 3 different ways to collect this, and one complements each other because they ask different questions in a complementary way, and so on and so on. And honestly, they are not always aligned from the beginning. We know that how things work. So you have different strategies to assess this. And for instance, just telling when it's emerging from the Parliament to the Commission is about missions. When it goes from the 2 committees is about cancer mission. So you ask different questions also in these different assessments. And also saying that one of the tasks of ECHOS, we are now submitting a proposal to continue this project for 5 more years. And one of the tasks that we have is about assessing or supporting the Commission to evaluate this at the national level, because we are with our feet on the ground through our partners, and we believe that this can also be a good complement to what these other approaches are doing. So thank you very much. There's Alicia.
There's Alicia, okay.
Well, but my question was partially answered because it was about the big amount of data that is incredible cooperation can bring, and about the processing of it, but you were answering it. And I suppose that perhaps you will comment on it later on.
Yes. Yes.
Okay. So.
Yes. So we. There's another question there.
Hello. Just have a quick question about whether one of your goals is to try and standardize prevention methods, diagnosis methods, and treatment methods throughout the whole of Europe.
Not necessarily, because I'll give you an example. HPV vaccination. No, in Portugal, we have 98% of young girls vaccinated for HPV, and I believe 92 young boys vaccinated against HPV, because our cultural setting is quite vaccine prone. We love vaccines. If there is a new vaccine, we go there. This is not the case in other countries, and I can tell you that we are working with Romania, for instance, where they have like 20%, if I'm not mistaken in the numbers, of vaccinated young adults, let's say. This is cultural, so we cannot just copy-paste different strategies. What works in Norway does not necessarily work in Italy or Portugal or so on. But we want to share best practices and, of course, then help adapting this. I can give you an example. For instance, Greece, Greece is one of the countries where there is no national screening programs for cancer. There are regional ones, but not national. We were in Greece in July, 1st of July, and the meeting was actually in the 2nd of July. So it was after doesn't matter. On the 2nd of July, we hosted a meeting together with WHO, IARC, which is the International Agency for Research on Cancer that is part of WHO, and the Observatory for European Health Systems and Policies, which is also another subdivision of WHO. These three organizations plus ECHOS and our partners in Greece, we mobilized the stakeholders in Greece to have a common discussion to get to an agreement on how to implement a national lung cancer screening program in Greece. Now, we had the meeting, we decided on a couple of things, or we recommended a couple of things. Now it's up for them to do implementation. This is one of the cases or a country we have nothing at the national level. In Portugal, we have breast, we have colon and cervical. We also discussed lung last year, November last year. And there was a decision after this meeting to prioritize lung cancer screening. And the 2 pilots will be launched now in September, October this year. So this is not necessarily normalizing things and making everything the same, but sharing experience. And sometimes what we need is really to have these people sitting on the table, sharing what are the concerns, the thoracic surgeons and the patients and the radiologists, and you know, see what is blocking and coming up with a common agreement, not necessarily a consensus. Sometimes we need to compromise, but getting to a common agreement on how to proceed. And that's what happened in Portugal, for instance, and we are moving forward. You know, the information was there, the knowledge was there, but nobody set them on the table all together in the same day to discuss it. So, you know, everybody was complaining, nobody was doing anything. And from the moment they were put together, discussing this and having clear views and recommendations and agreements, things happened. Not necessarily, again, copy-pasting, but helping this to advance.
And for the research call, it's pre-policy, so it's just about researching if, for example, in prevention, if the strategies are science-based and are effective. So it's not about standardizing, but about gaining knowledge on what will work and build policies from there afterwards.
Thank you very much. I think we should move on because we're running behind schedule. So thank you. And now I invite Harold from the EUSIP project. So welcome, Harold.
All right. I hope you are still have a little bit of patience with us. So EUSIP is part of the European Cancer Patient Digital Center. And those with an eye for the finer details saw this on 2 of Hugo's slides and 1 of yours, I think, as well. And on Hugo's slide, it was one of the recommendations for the cancer mission activities, and that was, I think, from 2021. In 2023, this had developed into this Mission on Cancer flagship project of the quality of life column. And at that time, it had 4 main components. The first one being informedness, the second being access to your own health data, the third sharing and understanding your whole health data, and then last but not least, the ability to make co-decisions on your treatment and possibly participation in research. So there's a huge difference to EUSIP, or of EUSIP to the other projects, and that is we are not doing research. We're doing science education, citizen education, but we're targeting not just patients, but patients, survivors, their families, their caregivers, and since 2025, actually also medical professionals. So the most recent objective of ECPDC that EUSIP is a part of that we got from Angelo Solimini, who's the EU policy officer in DG RTD, who designed this, is that it's a modular digital platform to provide evidence-based information along the cancer journey, as well as tools and EU-level guidance for personal self-data collection, and access to and the ability to share your own health data in a safe space for peer exchanges, and provide information for participation in research. This all in synergy and collaboration with the Knowledge Center on Cancer, the Cancer Smart Card project, and of course the Cancer Mission Hubs and the National Cancer Data Nodes that you will hear of and about in a little bit. And last but not least, we of course need to link with relevant EHDS infrastructures for primary use where it is appropriate. So we know that we need to involve many different experts, as we just heard, because we want to make sure that all the stakeholder requirements of what needs to be in the cancer information portal are known. And we need to make sure that the patients get access to high quality evidence-based information, all stages of the cancer journey. And that is not just medical information, it's also psychosocial information, legal support, and all these things will be by their nature member state specific in some parts, and within the member states, even region specific. So we chose a collaborative approach on the project, where we want to cooperate with external stakeholders and initiatives, both on the EU and the national and regional level. And we want to build the basis for the fully established ECPDC house. And this is our new architecture. In the first slide, it was 4 rooms next to each other. We made it into 4 floors. And the cancer information portal is the basic floor, where the objective is to address some of the inequalities in access to cancer information. Some countries like Sweden have very well established mature cancer information services and portals, Germany as well. We also want to make sure that the evidence-based information is available in plain language. The guidelines that come out of the KCC have some plain language versions, but they are hard to find. And we know that the KCC is working on that. And we hope to be able to help them on building this up and out. But we also want to establish the process to establish federated editorial boards to make cancer information accessible to non-experts. And then last but not least, we want to establish a federated network of cancer information portals, the architecture of which is still undecided. So here we see the project is made up of 40 partners from 17 member states and 1 non-member state. And again, there's a mistake on this. Apologies, Ian, again. Malta is in and not Sicily. These things happen if you have a large project, but we'll fix it before it goes live on our website. And this is the idea of our workflow project, where we collect from different sources the cancer information. We get a maturity assessment on the EU and member state level of systems and sources of information. And this is then collated, editorialized, combined with the input of experts. And this is not just medical experts, but also patient experts. And we will do a 2-stage rollout process, where we will do a pilot implementation in Lithuania with the first version of the cancer information portal. And based on that and some input we get from user experience studies, again, with real users of or intended users of the cancer information portal, where we will do a revision of what we found to be deficient, and we will do a rollout on 10 additional member states. And some of these already have the cancer information services, but they think it's important to show that this is for all of Europe. And the runtime of the project is about 4 years. We are month 3, and we still have a lot of things to figure out. But the good news is we have a lot of very, very highly motivated partners from all across the work packages that are really invested in finding the right information. Right, that's it from me. If you want to get in touch, those are our email addresses, and I'm open for maybe 2 questions.
Maybe we can take the questions after
All right.
Fang and Khadilis presentation. So now I present Lifang Liu, who is from the Candle project, and the Candle project is about this establishment of the National Cancer Data Nodes.
Thank you very much. Dear colleagues, good afternoon. Thank you, Ian and colleagues, for the invitation. So I'm presenting the Candle project. My name is Lifang Liu. I'm a medical doctor by training, and I'm also an epidemiologist. This one. So you read the title of the project is called Candle. It's an abbreviation for the National Cancer Data Node developers. And we hope the Candle can give also some light to the darkness of data that colleague already mentioned, the challenging getting data and sharing data. So I'm here on behalf of the coordination team from HealthRI. So a little bit intro about HealthRI. HealthRI is a foundation that has been established in the Dutch law. It's a not-for-profit organization, and the principal investigator of the project, Gert Meijer, is the chief scientific officer. And we received the national funding of 69 million from 2021 to establish the national health data infrastructure in the Netherlands. So not only the cancer data, but every health-related data will be streamlined in the infrastructure called HealthRI. So we have very close collaboration with our ministries, Ministry of Health, Ministry of Education and Science, and Ministry of Economics. And we are also leading a project called Health Data Access Body, the Netherlands. And we are establishing a process to enable the researchers to get to the data they want. And also we define the secure processing environment, that SPE, and also try to see how to build a catalog on the EU level and also on the national level. And we are a national node of several research infrastructures. I know all of you are researchers in the room. Who knows about these research infrastructures? Please raise your hand. Elixir, BBMRI, and Yatrus, who knows about them? No one. Yeah? 3, 4. Very significant. So yes, our job is to bring and build the national data node on what has been already established in the research infrastructure. So their aim is to really build something to help the researchers in a sustainable way. Like if you go from one city to the other, you can go on a bumping road, but research infrastructure really build a highway and make your journey more smooth. It's a pity that many of the researchers don't know yet how they can help gear up to what we can provide. So we are also a leading partner in many of the data infrastructure driven projects like the GDI, EOS for Cancer, CanServe, EUCAIM, and Quantum. I don't know whether you know this project or not, or be part of it. Anyone be part of those projects? Same people, yeah? More and more hands, that's great. So Gerrit and myself are leading the scientific part of the project, and we have a project management team from our neighbor in Utrecht, from Ligature. So Candle is a small project in terms of budget and the duration. We have 3 million with 3 years of running time. But in terms of trust and recognition, we are also a huge project. We have 40 partners throughout 20 countries involved, and we have 9 affiliated partners even on board. So they are not paid by Candle, but they still want to contribute and be part of it. And so far, you can see more abbreviations there. There are more research infrastructures involved. And we kicked off from the 1st of June. And we are in the month 2, 1.5. And this is how we want to deliver. So you can see the National Cancer Data Node is, it sounds like a cancer mission hub, but in practice, this is really focused on data, how to enable the researchers and also the data users, which is in the middle, to get to the data they want and useful for them. So in the middle, the data users category, we learn from the ECHOS project that the patient research infrastructures, clinicians, and also the public authorities that also align with the ECHOS vision. And the cancer data nodes basically are the pillars from the member state to build the European platform of the ncan.eu and ECPDC. So that 2 platforms in green, that's what the cancer data node from member state will support to deliver. So what Candle will deliver is really a functional cancer data node in member states that really works to enable the researchers along their journey to get their data that needed. So I heard from part of your presentation that you present a brilliant result from your research, but some challenges in getting the right data available is not mentioned. I'm sure you will have some crying time in the back of your presentation, but the solutions might be better through the national data nodes. And just like the cancer mission hubs, every country has a different healthcare system, has a different readiness to establish such a node. So we will design something that really tailored for different member states according to their maturation level. So maturation level is quite abstract, but in essence, it's to measure certain indicators how well the country is ready for establish such a node. So on the left side, you can see a very colorful European map here. The darker purple you get, the more ready you are in terms of policy support. So for the countries with dark purple or purple, they already get the policy letter support from their ministries to set up such a node. And there will be more work going on to make the nodes more interoperable across different countries. So if you ask me, what is the cancer data node and what Candle will deliver, I will split into 2 parts. The what is the content of the cancer data node, what it contains. So first of all, we need to sort out what is data. And it's not like every data is a good data. We need to sort out which data we are talking about. In the morning, I remember one excellent presentation talking about bring the lab, biobanking, and the hospital together, really to make the data flow from diagnosis, treatment, and outcome. That really is something meaningful. And this is what the cancer data node will deliver. It's not a collection of the tools and surveys that researchers need, but really a navigating tool, just like when you drive, you have a TomTom to bring you to the right direction, use the right tool. And then we are not starting from scratch. In addition to the research infrastructure that already built some solutions, we have the eCancer thematic working group. Maybe you are not familiar with this group, but this is a working group that's set up by the Commission. Really want to ensure the National Cancer Data Node is implemented in the EHDS framework. So within that working group, the member states representatives from the ministries sit there and define the functionality of the data node and how the data node and the patient information portal and the platform will work together. And that's really one important starting point for the Candle project. And then we also, with the ingredient in your hand is not enough. You also need to know the workflow, just like the navigation system, how the research journey will start and process and end. So the EHDS blueprint digital capability I attached there in a link that you can get later on will guide you through how Candle project and the National Cancer Data Node will help the researchers along their journey in the access of data, analysis of data, getting to the secure processing environment and archive the data in a more efficient and constructive way. And the how part, how to run the NCD, the National Cancer Data Node, we will really need to work together with initiatives like a Cancer Mission Hub to really start the national talks with the policy makers, and also not only on the national level, also on the EU level. And you remember that we will do a maturation analysis for different member states. And for member states, we will bring up a roadmap for their implementation. It's a little bit like what you have in the Cancer Mission Hub, the certification process, to see how you how ready you are, what are your priorities in your member states, and how to go about that, and how to stimulate member states to learn together. So that's my last point, really to work together with ECHOS to find synergies. You already bring a lot of stakeholders from the ECHOS project, and we also have our stakeholders for the National Cancer Data Node, and we need to work together on that. In the Netherlands, we have a very mature Cancer Mission Hub that led by Carla van Laar. And we are in close collaboration because they are more in charge of the cancer data, cancer agenda, and we are more in the cancer data. And you need the data to deliver the cancer agenda. That's our ecosystem in the Netherlands. So in the end, I like to close my presentation with this vision from our policy officer from RTD, Angelo Solomini. So that's the vision about the Candle project, the National Cancer Data Node, and its relation with ECPDC and NCAN. So basically, Candle is like with two hands linking up these two European platforms, because on the European level, the national nodes for cancer data should be supporting these two platforms. And eCancer thematic group is really the mechanism to implement the national data node into the EHDS system, touching upon primary and secondary use. So I know it's a bit abstract for now, but with 1 month and a half. So, but with the ending remark that we want to make something really functional and working for the researchers, and that's the policy position that we are in. So happy to answer any questions you have. Thanks.
And we now have Kadilis Wayman, who is joining us online. Is it working? Yes. Okay. So now we have Kadilis Wayman from the ANCAN Connect project, and she's joining us online. So Kadilis, can you hear us?
Hello, greetings from sunny Estonia, sunny Tallinn. And thank you for inviting me. I can hear you well. I hope you can hear me well as well, and that you can see my slides. And I would like to give you a very high-level overview about ANCAN Connect, which is a major European effort to build a decentralized collaborative network with one big common goal to advance cancer research and innovation through secondary data use. I am head of Estonian Cancer Network ESCAN, and I am here on behalf of ANCAN Connect coordination team and also on behalf of our consortium. And we firstly, to give you a very brief overview about our consortium itself, it is very much multidisciplinary. We have altogether 53 partners from 19 European countries and associated countries. We do have also industry represented, small and medium-sized enterprises, large enterprises, but also, of course, NGO and RTOs. The expertise is very, very high, ranging from technology, organizational expertise, clinical research, of course, and innovation and development. Our partners, of course, include EU research infrastructures and cybersecurity, AI experts, and of course, oncology researcher teams who are then piloting real-world use cases. Sorry, I got a message that you don't see the full screen. I will try to fix it. I hope now it's better. To continue, the main concept of Uncan Connect is to create the centralized collaborative network, what we call, and how Ian also said, is a federation of federations, meaning that we connect the national cancer data nodes, what Li-Fang just mentioned, talked about, and what they are, the concepts that they are developing. We connect them with the Uncan Central Node and the cancer data nodes, national cancer data nodes are connected with different data holders, meaning hospitals, biobanks, universities, so the data doesn't move to the central nodes, for example, but it actually stays in its location. And federation of federation means that the data or metadata can, under the specific rules, conditions, can move between central nodes and national nodes. What is underlying of this kind of, let's say, developments are the 6 major cancer type targeting use cases. They are listed here. They are carefully developed. I will come back to that, but they are serving as templates or backbones, meaning to develop specifically for example, common practices for data usage, for data access, for example. They are kind of mini projects within this big project. And based on these use cases, we will develop different tools to provide, for example, data services on source on national cancer data nodes, and also to provide end users analysis, computing, etc. And the Uncan Central Node is connected to the research infrastructures, also what Li-Fang mentioned, BBMRI, Elixir, other, but also connected to the different EU initiatives, the legacy projects, but also projects to become, because this will hopefully grow out from the project status and will be part of the bigger EU initiative, also to be well integrated with EHDS. To go more specific, sorry, I can't slides. Our main objectives, of course, there are more, but these are most important ones. We start to identify the needs of different stakeholders, if they're regional and national, and the goal of that is, of course, to be aligned with their expectations. This we can also realize through the participants of the use cases, but not only. Different initiatives, of course, Candle project will be a good partner in that. I'm ECHOS and the National Cancer Mission hubs as well. We will set up Bank and Connect governance model. We plan to do it firstly as an interim model because we have many activities to ramp up, particularly in the early phase of the project, and everything that is associated with realizing those use cases and building these tools, guidelines, best practices around the use cases. And that's why also the analysis of them is needed. We can map users' journeys, define the data flows from the source, for example, from university to this endpoint, which can be easily other university in the other country, for example, and so on. Then, of course, the data governance, compliance, and operational framework, which is kind of a mouthful, but it allows to standardize many processes and procedures that will govern the flow of data and information. It will be, the EHDS will be integrated into it, or I would need to say vice versa. Then, of course, guidelines for data processing at source. This is what we can provide through the central platform to different member states, to different data users. Then to develop and deploy the platform's components, the architecture of the platform, taking into account the federated structure and the interconnection with different research infrastructures and also data spaces. And then, of course, performing a series of use cases, targeting 6 different cancer types, and then continuously promote project outcomes to different communities, stakeholders, and ongoing and future European initiatives. And about use cases, as I mentioned, there are use cases are targeting 6 different cancer types. However, in total, there is 11 different use cases. They were chosen, taken into account different aspects, such as that pediatric cancers would be represented, but as well as adult cancers, poor survival rates, cancers, gender-specific cancers, and also common cancers. And also the data that these use cases, of course, can produce, that we can take as an example or backbone to develop tools to do data harmonization, for example, and but also to understand what challenges lie ahead if we want to combine, for example, different data sources, data sets. And the main expected outcomes, of course, is the uncan.eu platform and the network itself that allows us to link the cancer data nodes throughout Europe together to provide good services and tools. And the second very important outcome within this project, but I'm confident that this will continue after Uncan Connect will go further than project, is the use cases at the moment, because through those use cases we actually get a much better understanding about the cancer, and this is the end goal, what this project wants to advance also after the end of the project. So I would like to thank you, tell you that let's stay connected. Here is our email addresses, and yes, thank you.
Thank you. Thank you, Kadelis, and thank you to all the speakers. So as you have seen, there is this new refocus of the cancer mission on data initiatives. This was something that when we were writing the ECOS project was already at the back of our minds, but not as concrete as it is today. So this is why we would like to have this panel discussion between the three projects. And I can tell you that this is the first time that these three projects are four projects are meeting together, because the EU SIP project started on the 1st of May, the Candle project started on the 1st of June, and the Uncan Connect project will start in October, 1st October. And the ECOS project started about 2 or 3 years ago. So the intention of this panel discussion is to stimulate a little bit of thoughts of what role the National Cancer Mission hubs can play in this entire EHDS, which when we were writing, at least when we were writing the proposal for ECOS, it was not entirely clear what the role should have been. And now that we are moving towards applying to a follow-up project to ECOS, it's very opportune that we're having this discussion to understand more how we can collaborate. And my first question to the panelists is precisely what role can the National Cancer Mission hubs play? And how can we support this alignment, this integration and uptake of data? So I would like to hear a little bit of your thoughts of how we can kind of align ourselves more in the future.
I can start. If the micro, yes, that's better. So I think there's an interesting way one could layer these projects. If we come from Uncan Connect, you saw clearly on Kadili's slides that Uncan Connect needs working national cancer data nodes to work. So there's a clear flow of what needs to come first and what comes second. Also, it's pretty clear that the EU SIP project is the start of a pretty large EU initiative. And the National Cancer Mission hubs, I think, are the easy way for member states to start getting involved in building all these different facets of European-driven initiatives to work towards the 13 recommendations of the Beating Cancer Plan. Also, it's very clear that people get easily confused about mission hubs and cancer nodes and cancer information portals and modules and all these things. And it is, I think, one of all our challenges, so a challenge for all of us combined, to make sure that people understand that we are not competing, but that we are complementing each other and are collaborating towards the goal of improving the life of, what was it, 5 million new cancer patients per year in 2040? Three right now, but 5 in the future. So it's also important to see that between the establishment of the ECHOS project and today, even for specific projects like ECPDC, the European Commission and the Mission on Cancer continues to develop their understanding and idea of these projects and what their goals should be. And it's not always like scope creep. So in EU SIP, for example, we have a scope reduction in mostly science education, and we're not having actual integration into research. For that, we need to go back to Uncan Connect, but there needs to be like a clear connection from A to B and a clear path to go there that's not just along the patient journey, but also about the data journey.
Yeah, if I may continue what Hara had been saying. So what came to my mind are two words. First one is member states. So all these EU projects that presented before, Uncan Connect, EU SIP, and CANDLE, trying to build some infrastructures on the national level, and also ECHOS already a front runner, bring the stakeholders together. So as a very pragmatic person, and I'm a medical doctor myself, so either the cancer hub, cancer node, or any information portal should not be a goal of itself. It should be a means to an end. What is the end? It's to improve the patient life. Whether it's 3 million, 5 million, 2030, 2040, it doesn't matter. The patient and the society should be the ultimate goal. That's number one, member states. And number two, it should be functional. So I think Cancer Mission Hub already defines certain functions and deliverables in the project itself. And the cancer data node within the CANDLE, we have the eCancer working group already defined some functionalities that the cancer data node should deliver to the users. And the patient information portal, of course, facing the citizens and patient and caregivers, etc. So all these three projects combined should serve a very large spectrum of functionality that serve from the patient and the citizens. Again, ultimately benefit the patient. So these two keywords, I think we should emphasize. One is to complement on the member states and collaborate efficiently and deliver the function that really make the patient life better and make the researchers' life easier. That's my understanding.
Yeah, if I can continue, thanks. I agree absolutely with what? Can you hear me now? It's wanted to bring out that National Cancer Mission hubs are in a very unique position because they are national. There is, to my understanding, only one National Cancer Mission hub per member state, and in their power there is ability to reach to the stakeholders in the different regions of countries, to also reach to different stakeholders that certain projects, is it Uncan Connect, for example, or any other kind of initiative cannot reach. So I think the National Cancer Mission Hub definitely will be as if I may say, pipeline somehow to reach to the national key stakeholders. If I think about in context of Uncan Connect, for example, then there are many data holders in many hospitals, universities, but also companies, and I think the main understanding about them, but also I think there are many cultural aspects, but also legal aspects and silos all around that actually National Cancer Mission Hub can help to, let's say, bring those together, more together. And here I can see definitely very much value between is it specific National Cancer Mission Hub or the network of hubs, but and the value between Uncan Connect and maybe some specific developments or tools that we have in our mind to develop and apply.
Thank you for that, Kadilis. And now I turn to Ugo. And Ugo, how do you see ECOS and the National Cancer Mission Hubs working in this whole landscape? So we've heard that the National Cancer Mission Hubs do have the ability to reach national key stakeholders. They have the ability to serve like a large spectrum of stakeholders. How do you see the role of the National Cancer Mission Hubs working with these data infrastructures?
Well, that's basically what Harold, Lifang, and Kadilis said. We have already 2 years ongoing, so we already have some national implementation. We can definitely help these 3 projects to reach stakeholders. But I think it lacks here is the complementation on the other side, the flow of information back. So this kind of events that we are doing here, where we are connecting with researchers, and we can also bring what the researchers need to these projects. Because, allow me to say this, and don't get me wrong, but none of your projects will work if you don't have data, and data is on that side. There is funding in the different projects to have this kind of pilot projects. Kendall just, and Can Connect just presented 11 different initiatives they will do, but it would be naive from us to think that the Kadilis, how much do you have? 30 million? 30? Yes. The 30 million will solve everything. So what Kadilis is doing, or the project is doing, is having pilot projects that will generate some kind of data to support building up this national cancer data nodes. With this data, they will get, this infrastructure will use this data to train also the infrastructure. But then there is the need to get more data from outside the project, from other projects funded by the Cancer Mission, also related with pancreatic cancer, with neuroblastomas, with whatever. There is a need to connect with Kendall, because Kendall then will connect with policymakers. I've just explained that we are working with the European Observatory for Public Health Systems and Policy from WHO to train the National Cancer Mission Hubs on how to do policy dialogues. This is where we can connect with Kendall, and we too can run policy dialogues to raise awareness of our decision makers on the benefits of this. You are the ones benefiting, or you can benefit from data, but we also need your data. So this is the two-way flow that I think we can help, and of course not to exclude Harold and USIP, the portal. USIP will develop this very interesting portal with the information towards the citizens, and replicating this at all national levels. As we heard, there will be a pilot in Lithuania, then 11 more, but we are much more countries than this. We are more than 30, if we count with all associated member states as well, associated countries. This is where we can help by, for instance, mirroring the portal in our own structures. So this is a two-way street, let's say. Of course, I understand there is a lot of what ECOS can bring here, but also what ECOS can bring from that side and channel into this project. And I think that's it.
Thank you for that, actually. And I turn to Ana Toledo as the representative of the cancer mission, and how you look at this kind of landscape that has been created now. Does this mirror precisely what the Cancer Mission Board was looking for when it comes to the operation of this landscape between the National Cancer Mission Hubs, between the National Cancer Data Nodes and the whole EHDS?
I'm really happy to see these synergies. I think it's really important. This is one of the mission is really trying projects to connect to each other and to make this kind of synergies. I think it's very important because everything is moving really fast and there are a lot of, the objectives are very clear, but there are a lot of projects, and the board and the commission is very preoccupied about repetition, for example. I think the hubs really can canalize all this information. For example, in Spain, the national strategy on data is being built. It's also the use cases are cancer cases, and the proposals are moving on, but there can, at the moment, they are kind of disconnected with UNCAN, for example. I think UNCAN knows other actors that are there, but I'm not sure they are connected. And everything, as I said, is moving really fast. And I think there's a big opportunity to really create synergies and not to repeat all. So I'm glad to see they are going on.
In fact, yes, the synergies in the ECOS project, at least, has been working quite hard with these projects. We find it quite difficult to actually operate through this whole maze because it is quite vast. Also, how to bring the priorities of the other projects together. So it's not an easy task at all, which now leads me actually to the second round of questions, and this now relates to, so you mentioned in your presentations a number of obstacles which could be already identified at this stage, and maybe some barriers. These could be legal, technical, they could be institutional barriers, and they could also hinder this interoperability of the data. So my question is, what solutions are within the National Cancer Mission Hub's reach? So what solutions can the National Cancer, not solutions, but maybe how can the National Cancer Mission Hubs help to address these barriers that could be faced already now in the beginning of your projects?
Does it work? Yeah, wonderful. So indeed, every researcher in this room will suffer, have been suffering from the data access, the obstacles that everyone meets over the research journey. And I think what ECOS can bring is really to bring the users and the data holders to the cancer data node to really validate and calibrate the solutions that the infrastructure want to bring. I was a bit astonished to see that only a couple of you knows about those infrastructure. And if we build a national data node, that's just a beautiful sculpture there and nobody use, it's a failure. So again, I emphasize it should be a functional one, but the baseline or the basis for a functional cancer data node is the user has to come to the node. And I think that's where the cancer data, mission hub can really help to bring the voice from the users and to bring the question to the infrastructure builders, and then the two will come together.
Yeah, I would, first of all, I think it's really interesting to see that the new cancer mission projects have this collaboration baked in the calls. That was not always the case. So that's a really good improvement to, let's say, 2020, 2021 times. And CANDLE is not just building the national cancer data nodes, but also has, as part of its job, to make sure that these projects work together. And when we worked on the ECPDC implementation study 2 years ago, we found lots and lots of projects. They all were kind of related, relevant, but didn't know of each other, and all had partial solutions that overlap but weren't quite compatible. So that goes to your earlier question about how to measure success. And the Cancer Mission has recognized that there is a great deal of risk reduction when it comes to the success of projects if the people that do the projects actually are being informed that there are other projects and that those work together. And this again is something that the Cancer Mission hubs can do on the national level, because we also have a lot of national initiatives in member states that are larger or smaller and sitting next to each other that do not necessarily have something like a shared cancer registry, for example. Even though, I don't know, I live, I think, less than 60 kilometers away from the Polish-German border. I know there's a Baltic bone injury registry, for example, but there was a project, and that's, I don't know if it still exists. And this is another risk where I think the establishment of Cancer Mission hubs that concentrate on the member state level, the points of contact where you can find out requirements for something like the National Cancer Data Nodes is super important for the sustainability question, which Ian thankfully works on in the EU SIP project for us. So there's, because there's no future for every single of us, but there is a future for all of us together in the actual mission on fighting cancer.
I don't know if Kadelis also would like to say something.
Yeah, I just wanted to mention what I would see what could be the barriers. For sure is legal fragmentation, for example, but also institutional silos, technical inconsistency, and I can point it out based on Estonia, which is a really small country and still needs much coordination, much aligning between those different stakeholders responsible for different areas. Is it legal? Is it policy making, research, etc.? And again, I think National Cancer Mission hubs can very much help to overcome these specific national barriers, but also it allows us to study or to get best practices from for example, national cancer mission hubs, which are on regional level. For example, if I talk about Estonia again, of course, Finland, Baltic states, Sweden. So I think this is obstacles that could be overcome.
Thank you, Kadelis. Ugo?
Are running out of time. Very, very briefly, just saying that this that Harold alluded is something that is new, but is something that is specific for the Cancer Mission. You all know about European projects. Probably you have worked, collaborate, or even coordinate some of them. And if you were a PI from a project, let's say funded by Horizon 2020, and maybe even Horizon Europe, you are granted with the money and left alone to do your project and generate results. In Cancer Mission, the Secretariat from Cancer Mission created what we call clusters of projects. So you have a cluster for prevention, a cluster for diagnostics and treatment, a cluster of quality of life, and it is the European Commission itself, the Secretariat from the Cancer Mission that sits in the European Commission, that organizes regular meetings between funded projects. So the European Commission is promoting these synergies at the European level with the projects that are funded by the mission itself. So this is quite simple, but a major breakthrough if you know the European Commission and how it works for several times. This is something that national cancer mission hubs can do at the national level, because sometimes we also face this siloed community in our countries. How many times do we find projects that are even in the same university working in similar topics, but do not talk with each other just because they are not aware? So this is something that the National Cancer Mission Hub can do in a systematic way to organize these meetings and so on and so on. And I want just to make here a small note. One of the topics that we are working in ECHOS is how to generate impact. How to generate impact in diagnostics, treatment, quality of life, and so on and so on. We are developing a methodology based on existing methodologies, but now applying to cancer and so on and so on. And what we see is that many times you have your results, the things that you kind of control, your outputs. Then you have the outcomes, which is something that is beyond your control, but still in your influence. And then you have what we call impact, which is way down the line. You don't have any control or any influence on that. And many times what we see as big impacts were something that were not planned and happened because people got together and they talked. And suddenly, coordinator from one project and the other project met in a different meeting or whatever. They discuss ideas, and then there is a new proposal, there is something. So sometimes the impact is generated because we put people together. It's not the only way of doing it. It's a factor that contributes. Of course, I'm not saying that we are just doing meetings and more meetings. But sometimes all you need is a space. And I give back the example from the lung cancer screening in Portugal, where we generated the opportunity for people to meet. They had the expertise, they discussed, they got to it, and it accelerated. So this is, the National Cancer Mission Hubs do not have the mandate to act on regulatory issues or other topics that were discussed and were formulated in your question. But we might have the network to put people together that can contribute to this and somehow manage a discussion where we can help or facilitate or accelerate, depends on what we are talking about, different topics that are flagged as important. The other thing that is also needed to be said is that different countries will have different setups. For instance, you in Malta, you are the National Cancer Mission Hub and the National Data Node. You will have two hats at the same time in the same organization. So it will be easy to create this bridge because Ian is coordinating everything. In Portugal, that will not be the case. So we have to coordinate between institutions, and you all know how it is to coordinate between institutions. And different countries have different setups. So again, the recipe will vary from country to country. But I think what is the common ground is that we are all aiming for the same, and this is where we can help each other. And before going to the key takeaways, I've been told there are comments. Can you hear me now? Yes. Okay. So before going to the key takeaways from this session, I would like to invite. I heard there is a comment or there are questions from the audience. Yes. Yes, Alicia.
Thank you very much for this very interesting meeting. And I hope that next we can see that through the television in the international channels, because it's really very interesting. A curiosity, I was really very interested in the collecting data so that the patient can assess to the data in an easy way, because of course, for instance, here you have the right to access to your own medical experience, but sometimes you don't get out much of this. You have to go to another doctor just to explain what is writing on the record. And having this is very interesting. And at the same time, do you, when in the case of cancer, in which many patients noticing in advanced stage of the disease, have you thought of creating a database where they can consult the last treatments and also the last research, so they can contact the research groups who are looking for volunteers to try their therapies? Because this could be very useful for the patients and their families, so that they can reach this data directly without doctors, because perhaps the doctor won't say anything, perhaps would think you are too old just to benefit, or our social security system perhaps won't fund it, but the patient has a right to know nevertheless.
So that was part of the 2023 idea of ECPDC, and the scope changed a little bit. But the scope is still to point patients that have the energy, capacity, and interest to do so, to find that. I'm also involved in another EU project that's called My Health in My Hands, which is about providing access to your own data, health data in cross-border context, but it will very clearly collapse into any kind of context. So we are thinking about it, and I can say that Lifang and I, we had discussions about how much we can actually ask of patients that are already dealing with cancer when it comes to furthering research. So one of the original ECPDC tenets was to put the patients and survivors' needs first. And that usually is not participating in some research that doesn't apply to their current state. And again, we are talking about people very often that have never thought about health, because they were always healthy, there were no problem, and suddenly they have cancer and their world is completely changed. And asking them to take responsibility like this may be a very difficult venture.
Agree. And just to recap on our discussion, well, I see, and I like very much your testimony saying that the patient get their own data in hand, but they want to get them out of it, how to join a research that really help them. And when they bring their data to the doctor have a different solution to that. And the key is really how to bring the doctor's knowledge to the same level to the patient and vice versa. And then they can have a more efficient and useful communication. Normally in the practice, it's not the same. Although patients are informed, but it doesn't mean that they have the same understanding of their doctor. And doctor has the mission to let them understand, especially when they are already having so much suffer from their disease. So that's basically what I want to complement with what Harold has been saying. With the information doesn't guarantee that the patient will get the understanding, and doesn't mean they will make a good decision, but only with the doctor's aids, with their assistance, the co-decision on their treatment will work.
And maybe to add one thing, this is why I completely agree with the other scope change in EUSIB, that the science education is not just targeting patients, survivors, families, and caregivers, but also medical experts, doctors, and so on, to make sure that everyone is on the same page.
Well, I must congratulate all the doctors and health personnel who work there, because I'm sure that in most cases they give the most and even more. And as you say, it's a question of languages. And the second thing, to congratulate you for saying about the differentiation of gender and so on, because sometimes the treatments are very different from a man and a woman. So having this collection of data is very important. Sharing this at the European level is very important to design the politics and differentiated politics. And well, congratulate you for the discussion. And really, we have learned a lot of these projects which are very interesting. And I wish you the best luck, because they are newborn projects.
Thank you, Alicia. And I see another hand, so Katarzyna.
Yes, thank you very much, and congratulations for the session. It was really interesting and very informative. Also to see the synergies between the projects, and that is like the policy towards like the cancer and tackling the cancer issues is like taking seriously. And that is why I will have a strategic question. Ugo, you mentioned in your presentation, we are now in the very important period, because the next financial perspective is being discussed. There was a first proposal of Horizon Europe next edition prepared by the European Commission. How about the cancer mission and what the ECOS is doing? Is it a priority for the future? Do you participate somehow in the lobbying process to make the EU authorities aware on how this topic is important, on how the data collection and all of what was presented is important for the sustainability and for the research? Thank you.
Is it on? Yes. Yes, thank you very much. That actually resonates with the notes I had here for the final remarks, which is basically, we are now in the period for planning for the future. So I'm already doing the final remarks now, saying that the future is this. This future is collaboration between projects and within the country. Either if it changes gears from cancer to cardiovascular or neuro or whatever, this is what will happen in the future. And then we see this alignment, collaboration, you call it whatever, mission-driven, stakeholders engagement. We see this with different words, but we see this in very important documents that have been emerging. The Life Science Strategy, the ACT, Align, Accelerate, the Draghi Report, the new FP10 proposal. So regardless, I know we are talking about cancer here, and this congress, this conference, this symposium is not about cancer. It's about a lot of things, and antimicrobial and so on. But this is the mindset that we all should have for the future. Going specifically, if I and ECOS is influencing this, for the sake of conflicts of interest, we stepped out of the committee from the European Commission. Like I told you at the beginning, there are different committees. We stepped out because we were applying for a competitive call. So we are not sitting there anymore, but still we are doing in ECOS, for instance, a policy paper or a position paper where we state our vision for the next framework program. We are, again, not sitting there, but we are exerting our influence through different channels. And to do it, we have our ideas, but we also consult the community in the different countries. So that's why it is important, even if you are working not in cancer, to see who in your country is represented in these different projects, and knock on their door and say, look, I know that they are discussing the strategy for the next, I don't know, 7 years, and I have ideas, I have suggestions. Yesterday I was commenting, so we are also participating in public consultations and not so public consultations. So yesterday we received in Portugal, the agency I work for, we received from our Foreign Affairs Ministries officials request to comment on recommendations that the Council is. So because we are part of the national structures and we are connected, so the agency I work in Portugal is kind of, it was funded as an agreement between Ministry of Research, Ministry of Health, and even though we are not fully public, we are a public-private partnership, we are part of this flow of information and we are consulted in the topics of our expertise. So this is where we influence, and this is where you can influence if you know who are the players in your country. In, again, Italy, Spain, Malta, Poland, Hungary, and so on. So reach out to those that are part, either through ECHOs, we know how to direct you, the national contact points, another important representatives from the different countries, and yeah, so indirectly, let's say.
A really quick one. So we're running out of time. Okay, I see Anna wants to make a quick comment. Yes.
The cancer mission survival, I think it's almost guaranteed till 2030. But as told before, it depends on its evaluation. It's going to be there's going to be a midterm evaluation and a final evaluation. But I think, as Hugo said, that collaboration is what it's the future. It's what it's going to be, and especially in biomedical research, I think this is it for the moment and for the next 10 years. And I know that CSIC has a very, for those who are from this institution, has a very strong position on what research is, and you can talk to the Vice President of International Relations if you have an idea. They are really pushing forward for the research that is done here, for basic research, independence, and also for science for policy actions. I think this is the focus of not only the European Union, but also in Spain.
Maybe one last comment. The 3 new projects, we have agreed with the EU policy officer to meet on a regular basis, I think quarterly, so that there's an ongoing conversation, and that it's not like in 4, 5, 6 years, they get some results and then they go like, well, this is not helping us now because the follow-up projects or programs have all been decided upon yet, but it's an ongoing conversation within the framework of the projects. But there's always this difficulty. You don't want to bring the people that do the projects, hopefully successfully today, to not be able to apply for the future projects because they've been too involved in preparing them. So that's a little bit of a thing that needs to be carefully managed.
Very quickly. So what we are building here is not cancer specific at all, apart from the stakeholders that cancer very related. So I would say the infrastructures that we build, the network we build, and even the work operation flow that we are building, that's easily extensible to other disease areas. When you speak about impact, I think that's the real impact lies.
Thank you. And I don't know if Kadilis has anything to add. because I left you out even in the previous round. So I have to give you the floor in case you have anything else to say.
No worries at all. Yeah, maybe just to complement what Harald and Li-Feng said, and also very happy to see that this kind of initiative to collaborate, to create more and more synergies, that it has started. I really hope that it can serve as a good example for future cardiology mission, for example, but whatever the future holds. But I think we at least together with these 3 projects here and also National Cancer Mission hubs, we are entering into the very heavy implementation phase, and really to wish you us much strength that we can carry out all this the inputs and outputs that we have, and really create meaningful impact and synergies.
Please, I see one last question. Please be very brief. And
just a quick one. So you mentioned quite often data input, but you haven't really explained or expanded upon what sort of data you want to acquire. Obviously, from the cancer aspects of things, you're probably looking at patient history, patient treatments, but are you talking genetic data, proteomic data as well? I don't know if you could expand a little bit more upon that.
I guess the question was to me.
All
Thank
the
you.
data.
Yes, indeed. We are talking about clinical data. We are even talking about non-clinical. Yes. Can you hear me now? Yes, indeed, very variable data, clinical, non-clinical, genetic, proteomic, etc. So the use cases as well, what I was briefly showing, were based, very selected based on the different type of data that you can bring to the project, and this can then help to serve as an example. To include outside from the project, from the data holders as well, and use it for the further research. So many types of data.
Very briefly, it's very important to understand the trajectory of data. Then the data is meaningful. All data is there, but we really need to sort out which data along the patient journey are meaningful. That's the only way to interpret and extract the data from the diagnosis to lead the treatment, and the certain treatment lead certain outcome. That seems to be a common sense, but it's not self-evident for many researchers when they talk about data. So that's why in the cancer data node, we really like to make a strong case along this trinity of data to make sure that researcher got the right input at the right moment for the right database. Yeah.
Thank you very much. Thank you very much. And well, we have come to an end, but just before closing, I just want to give one last time the word. Some of you have already given your takeaways, but I know that some haven't. So I just want to give the last word for the key takeaways. I can say for myself, the key takeaways of this session were that number one, these are 4 flagship projects. There's a lot of money being invested into these projects, and it's important that the 4 projects do not work in silos. So today, I mean, the ECOS project at least has taken an active role in synergizing with these data projects right from the start. So one of them has not even started. The other 2 are really fresh off their kickoff meetings. So we lost no time to actually synergize with these projects. So that's my first takeaway. The second takeaway is on the national coordination. So maybe, as Ugo mentioned, Malta is one of the few countries which have immediately devised how we should organize our national cancer mission hubs and our national cancer data node. And we decided that the same organization will do the two functions. We already have a problem with the cancer registry, so we're trying to see how to coordinate with our cancer registry. But I think this is a national challenge. I see that this is, for smaller countries, it's probably a bit easier. For the larger ones, it's maybe a bit more difficult. But thinking in the future, I think we have to see how the 27 EU member states will organize themselves between the national cancer mission hubs and the national cancer data nodes. I propose to go the other way around. So we started with Ana Toledo first, and we finished with Kadilis. So we go with Kadilis first, and we go around for the takeaways backwards. So Kadilis.
Yes, thank you. Well, it's always to conclude and to give key takeaways is the difficult part. But for me, what I take away from this meeting indeed is the values that and collaborative approach that these four projects can bring to each other and to complement to avoid duplication, but how to do it specifically. This, I guess, is further challenges to for sure target.
Lifang.
Thank you. And I come back to my keyword approach. First one is functional. It should be working. The synergies on the national level. The second, again, the member states is key to be a ecosystem that really helpful for the patient and for the researcher. And thirdly, the impact. I think disease agnostic is the key of these 4 projects. So I think that's the real example on the European level for health research, that they should take the same thing, the same SOP in my language, to really run other disease and really improve the patient, not only the cancer patient health and in general.
Besides the things that Kadilis and Lifang said, which I fully agree with, I think Hugo already said it. We have to keep the conversation going between the projects and then make sure that we solve our challenges together, because that will be the force multiplier for the impact.
Yeah, just reinforcing what I said, we, the 4 projects, are here for you, for the community of researchers, for the community of patients, the healthcare professionals. So see this not as another European structures, whatever, but reach out to us, knock on our doors and say, we have this need, we are seeing this problem, we are flagging this and that, because it's your experience in the field that will help designing and developing better solutions for you.
So for me, the key thing to say is that the scenario is already set. The plans are there. They may be big and complex, but there are many roads to travel on. And now there's the money, there are the synergies that are being built. And I agree that the conversation has to keep going, but I think it's the moment to do it and to just walk to the objective of improving lives of cancer patients and families.
Thank you for that, and thank you also for your contributions. I'm very happy that this has taken place and the timing. So for me, what was most important as the work package leader on synergies in the ECOS project was the timing. So we did not want to waste time in bringing these 4 projects together, and we as ECOS 1 and even now in ECOS 2, we would like to continue these synergies. So it's very important for us. So thank you very much all for your contribution. Thank you, Bedo, who has been sitting here, who is our rapporteur for this session. Thank you, Alicia, and your team for inviting us and for giving us this space. And thank you to the audience for having listened to this, and hopefully you take away something today that opened up a new perspective in your day-to-day job. So thank you very much, and that's it. Thank you.